Okay, we're back from the break. Amy is on the phone. Amy, how are you doing tonight?
I'm doing just great, and I wanted to let everybody know how very happy I am to be a new patient of Dr. Michael Reiner.
Thank you.
And I'm so glad that I got to go meet you and to have a consultation with you.
Well, I'm glad that worked out for you. Thank you very much for calling in.
Oh, yeah, I will be seeing you on the 30th, and I hope some others try to go over and see you.
Good.
Okay.
Well, thank you for calling in. I appreciate that.
Thank you.
Okay.
Bye-bye.
Bye-bye. Yeah, a lot of times we get a lot of complaints in medicine, but it's always nice to hear when you have done something good for people and help them out. Anyway, with regards to that, thank you, Amy, for that call. I appreciate that. And trust me, I get a fair amount of comments about what we don't do. And we're always trying to improve the practice of medicine. And I think that's why they call it the practice of medicine. We kind of never get it right. But one of the things I've learned, one of the rules of medicine, if you listen to the patient long enough, they'll tell you what's wrong. And if you have the opportunity to listen to them even longer, they might tell you how to make them better. And like I said, it's all about giving you the advice to make your decisions based on you being an adult and responsible people, and trying to establish an honest relationship between you, the patient, and me, the physician, and giving you the information that you need to make a healthcare decision. I wish it was more like that in the world today, where we could remove the third-party payers and we could remove a lot of the interference, but that doesn't seem to be going away anytime in the near future. Until we decide to pay for our services on an individual basis and we decide to remove the insurance companies and things of that nature, which obviously would be nice if that would happen. I believe that the actual doctor part of healthcare, meaning your bill going to see the doctor, is probably the smallest part of the healthcare dollar spent today. I think the pharmacy costs have gone outrageous, and I think I don't want to say there's a conspiracy there, but I do believe that when you talked about generics, that there are some people that basically they'll buy, like if a drug goes generic, what'll happen is as a pharmaceutical house or a manufacturer will sell an exclusive license to a particular reseller, and they buy the product at dirt cheap prices from the original manufacturer. They do something else to it, and they market it. But they're the exclusive producer, so the price really doesn't drop that much when a generic comes out. That being said, there are other generics that don't compete with each other. So if we reduce the competition in the market for a particular product, therefore the price goes down. If there's a lot of competition, the price goes down. If there's not, then the price goes up. So that being said, something simple as Prilosec should be very, very cheap, but there are only a few people that manufacture it, so therefore the cost continues to go up. I encourage people to look at pharmacies outside of the U.S., even the Canadian pharmacies and other things of that nature. They're very easy to get prescriptions. Obviously, Mexico is a very good alternative source for prescriptions that are pennies on the dollar compared to the U.S., and we're relatively close to Mexico, but a lot of people are afraid to travel, and I do understand that. And the Canadian pharmacies are more expensive than the Mexican pharmacies, but they will allow you to at least research smaller in price comparisons. And so, yeah, the system is a little bit rigged, but I think pharmacy costs are extremely outrageous, especially when you can find the price. I mean, let's look at Prilosec for an example. In Mexico, it's probably, I think you pay $29 over the counter for it here. You could get that same prescription at a retail pharmacy for $3 to $5 sometimes, and there's no sense for that. And it should be an outrageous, everybody should be outraged at the prices they're paying for but everything is expensive, and they're just taking advantage of us all over the place. So But the doctor cost, it's very small. $80 for a visit, or $70, or whatever that cost would be. How often are you going to the doctor? Well, if you have pain medications, you're going quite often because of the new laws that were passed. But aside from that, usually people on the average are not going to the doctor but once every 3 months, maybe 4 months, and getting blood work done or getting a review, unless you've been sick or you've been in the hospital, and those are the rarities. But I mean, if you're a relatively average person who doesn't go to the doctor that often, and you're spending thousands of dollars on insurance, you may spend, if you had to pay for that out of pocket, you may have spent maybe $200-300 to go see a family practitioner or a local doctor. But if you're very, very sick, then insurance becomes very important, because if you go to this specialist or that specialist and 5 doctors and you're driving and you got chemotherapy or getting cancer, well, then my theory goes out the window, because then you're spending a lot of money seeing different doctors and different specialists. And that being said, but for me, a family practitioner, the cost is relatively cheap for that. I think we have caller Jim on the phone. Jim?
Yes, I'd like to ask a question. Is there any difference between a TENS unit and a neurostimulation? And do they both work, or one works, the other one doesn't work?
Yep.
So
a TENS unit is basically a transderm stimulator. It basically is on the tissue itself and provides a kind of a vibratory type of thing. And what that does is it alters the sense of pain by giving your body something else to concentrate on. It's that old kind of saying, you got a headache, let me hit you in the shin with the steel pipe and you'll forget about your headache. So it's kind of in that realm, meaning it stimulates the skin. It's a very, it works in some cases. I can't say it works in every case. The other nerve stimulator that they actually implant in your spinal column is a very invasive procedure, and assuming that it gets implanted by the right person and you have no complications from the surgery, can be very effective in stimulating a nerve, and applies a much deeper electrical impulse, the same basic principle, but directly against the nerve root, and then you get a lot more pain relief in that. And so there are a lot of things they'll do in that respect. They might even burn some sympathetic or some other nerves to try and alleviate that. They may inject Decadron if the nerve is inflamed, as in a disc situation in your back. So I hope that answered your question, if you're still there. But if not, then that's basically the difference between the two. And usually you would want to engage in the neurostimulator deep in your tissue as a good alternative to having surgery, because surgery is kind of a last resort, because of the scar tissue in your back and other pain situations could leave you with a worse situation than you were before. And there's no guarantee that surgery gives you the best outcome. And I think rehabilitation, getting good exercise program, good posture program on lumbar sacral pain, and non-steroidals is very important. Anyway, one of the things we had talked about a lot on this show was the pain pill epidemic, and that kind of leads into that. And I've done a lot of ranting about some of the pharmacy issues and where we are today. And there really truly is a pain pill epidemic and a pain epidemic in our society. We are growing in age, and we have a lot more arthritises. We have a lot more issues that we're being faced with today than we've ever been faced with before. And everything was honky-dory up until 2012, when we had this Walgreens issue in Florida, where they were not paying attention to the billions of prescription, not billions of prescriptions, but billions of doses of oxycodone that were being distributed out into the community in a small area in Florida. And as a result of them getting, because of the pill mill bust, it started a whole chain reaction of issues that have permeated through society today and through the market today. Okay, so we have another caller, Dave. Dave, are you there? David?
Hello?
David?
Yes.
Yes. What's your question?
Having difficulty hearing you. You sound like in an echo chamber, doctor.
Well, I'm not, but I think it's the feedback coming through the phone line.
That could be it. I'm David Lancaster, and I'm a new patient of yours. I've yet to see you. You were recommended by Amy, and I just hung up with the flat man, Ray. He said to give you a call. You're on television. I don't watch television, though I am a broadcaster. And I understand that you have quite a good name in Pahrump, and I want to thank you for all that you're doing for the people of Pahrump. I will be mentioning you on my radio show in 2 weeks, and it isn't often that you get a compliment, as I'm going to be giving to you, as the people around Pahrump have been giving me about you. So thank you so much for your help in this community.
Oh, you're quite welcome. Thank you, and thank you for calling in, David. I really appreciate that.
You're welcome, my friend, and we'll see you soon.
You bet. I look forward to it. And again, thank you, David, for those kind words. And I have been here since 1999 and have been trying to give out the best medicine that I can to patients. So I think for those people, and certainly there are people that think I'm the worst guys that came into the valley, but those are few and far between. And it's funny, I had that comment where I did have a patient who told me that they wouldn't come back to see me, and I asked them why, and they wouldn't tell me. So that was kind of unfair, because I like to learn from my mistakes, and I like to learn from the mistakes of other providers who have in this community who have upset patients. It's not often that we get a chance to apologize and try and make these right. But I've always felt like if I can clean up my side of the street and apologize for what I did wrong and try and make it better, I certainly will. Anyway, we're going to be going to break, and when we come back, I'm going to bring up some interesting data that I found on some of the epidemic of prescriptions and issues that are in our society today, to put some real numbers on why we need to be, as doctors as well as patients, be more aware of this pain pill epidemic that we're facing, and the things that we can do to help thwart diversion or the taking of one's legitimate prescription and using it for alternative purposes. This problem does exist. There's no way that I'm going to be able to solve it. There's no way society can solve it. That's like solving alcoholism. You have to find a way to cure yourself and treat yourself, or suffer the consequences of that behavior. But anyway, we'll be back from a break, and again, thank you for tuning in.